The stories of long waits for treatment in A&E are very personal for some. Graham Smith's grandmother, Vera Murphy, was left on a trolley in a hospital corridor for 33 hours, aged 92. Her family just one among the countless who experienced the crisis in A&E firsthand. Vera died 10 weeks later.
I draw a line between my nan sitting on that corridor for 30-odd hours, crying and wishing she was dead, incredibly ill, fearful. I draw a line between that and a death 10 weeks later. Would she have lived longer if she'd have been seen quicker? Maybe. But it certainly would have made the last few months of her life that bit more comfortable, and I think she deserved that.
The cost of long waits in A&E has been laid bare in estimates from the Royal College of Emergency Medicine. As many as 268 deaths every week last year. And they say that doesn't include the patients delayed in the back of ambulances before they even get into A&E.
Our hospitals are so full, the efficiency within our hospital suffers, and we end up with people taking long stays in an emergency department. This then translates that they have a longer stay when they're admitted to hospital because it takes them longer to get better. We're in a situation now where getting admitted to hospital will make people worse rather than better.
Sue Richards spent 12 hours in pain on a trolley in A&E waiting to see a doctor. She says she knows she's one of the lucky ones.
I couldn't fault any of the staff. It's just the system. It's the way it's been run down over the last few years that people just aren't getting helped anymore. And it's, you know, whatever you do, don't get ill. That's how it feels.
In a statement, the Department of Health and Social Care said efforts to admit, transfer or discharge A&E patients within 4 hours were improving. We are determined to continue improving experiences for patients and making access to care faster, simpler and fairer, it said. We're making progress in reducing A&E waiting times, including adding an extra 5,000 permanent staffed beds this winter to increase capacity and help patients be seen as quickly as possible. But 1.5 million patients waited 12 hours or more last year, and the Royal College says its estimates of excess deaths are probably conservative. The link between delays and deaths, they say, is clear, and those deaths completely avoidable. Greg Milam, Sky News.